Our vision for pharmacist services starts with the New Zealand Health Strategy. So the New Zealand Health Strategy was consulted on and developed through 2015-16, and it was published in April 2016. The key to this strategy is it's people-powered, closer to home, value and high performance, one team and a smart system. Those themes apply across the world. So although they're special to us in terms of how we've been developing it here in this country, it's actually very consistent wherever you go in the world. The direction of travel is away from hospitals. The direction of travel is towards supporting people well in their own communities and in their own homes. The direction of travel is actually saying that people with long-term conditions and complex comorbidities can get better care in their own home and in their own space, because actually we can't solve their problems in a hospital. The direction is also about prevention, early intervention, helping people to live the best possible lives. And so the direction that the DHBs are seeking to drive is in that direction, shifting services closer to home, enabling people to live good lives in their own homes and in their own communities. What we did with this process is, having had a New Zealand Health Strategy, we then needed to, how do you make it real on the ground? It's good to have themes, it's good to have a direction of travel, it's good to know what true north is, but actually how do you do it? And that's where the Pharmacy Action Plan came in. So that says very clearly that pharmacist services are an essential part of a people-powered integrated model of care, delivered in innovative ways across a broad range of settings, so that all New Zealanders have clinically appropriate access to medicines and healthcare services. The action plan is the basis for what we're actually proposing here. This is, how do you take what's in that document and make it real on the ground? But what we're really trying to do is make sure that we can take pharmacists with us on that journey, and you design the future with us, rather than us go and sit in the corner and come up with the answer for you. And it's also about taking an integrated approach, because this is about the whole of the health system, and even broader, the whole of the health and social care system working together to deliver the best possible outcomes for our people. The action plan has 4 focus areas and some tools for change. So one of the things about those tools for change is leadership, smart systems, workforce and regulation. So those are the platforms. Those are the things that we have to have in place to enable us to deliver on a different future. The plan gives lead accountability for each action to either the Ministry, the DHBs, or the health and disability sector. However, if it's going to succeed, we're all going to have to work together, because we actually all have to move those pieces to create a solid platform working together in a coordinated way. Following on from the action plan, the DHBs ran a process about how we could deliver this in an integrated way in the community. And we went back and we talked across New Zealand, DHB by DHB, and also some national hui. And this is the vision of an integrated pharmacist services in the community that came out of that. It highlights new opportunity for pharmacists to contribute in different ways across the health and social care system. It supports the role of pharmacists as key members of a wider primary care team, and expects that pharmacists will be the experts in medicines management. And it delivers on our key government directions, including reducing inequity. It's a fantastic vision, but again, to successfully deliver on this, we need to make sure we have all the pieces of the puzzle lined up, and we also want to work with pharmacists to deliver it. All across the country, new and innovative programs have been developing, which have been supported in part by different DHBs. There's more than 100 services currently being delivered outside of our contract, and this is one of the services. It's one that's actually delivered in Canterbury, where I come from, which is anchored in community pharmacy, but enables that medication therapy assessment focused on individuals that are most vulnerable, and acts as the linking point between the pharmacy and the general practice to ensure that we have a coherent, joined up model for the person.